Good evening, everyone. Welcome to tonight's webinar. It's another wonderful moment for us at World Life Foundation as we host the sixth episode or the sixth edition of our World Life Health Talks. My name is Christine Vishima and I am the Programs Officer at World Life Foundation. It's always a pleasure to be here with us, as always. Shout out to Umar that is here online. Thank you so much for being here, Yahaya. Always showing up and being one of the first to show up. Hi, Mercy and Maddie. Welcome. Please share the link with others around you, your family, your friends. You can just click on the share button. If you have not subscribed to our channel, subscribe to our channel. And we are going to be having a wonderful time here tonight. Good evening. Hi, Mujiba. Thank you for showing up as always. Yes. So what is the World Life Health Talks? First of all, let me start with a little introduction about World Life Foundation. World Life Foundation is a medical health care service foundation that is focused on providing quality and equitable access to healthcare for the underserved. Now, we work with the underserved, both men, women, and children, but we are particularly very interested in women's health. And that is the essence, one of the reasons why we hold these health talks, to be able to create awareness concerning, medical conditions that many of us may have heard about, but do not have adequate knowledge about. We have treated so many other topics prior to now. We've talked about PCOS, now known as PMOS. We've talked about endometriosis and so many other interesting topics. Today, we are going to be talking about why does IVF fail? Why does IVF fail? And today we're going to be having a very interesting time talking about why IVF fails. And to take us through tonight's session is no other than our dear Executive Director, Dr. Ibrahim Yakub Sime, who is going to be taking us on this session tonight. But before I bring him on stage, I want you to take 1 second to share the link to this live with someone in your space. You can forward the link to your status. In fact, you can take a screenshot of your screen and then forward it to your status with a link to tonight's webinar. Let us get more people to join us. This topic is a very crucial topic, and it is not just for those who are married. It is for some of us who are single as well. So it is important that we spread the word. So please, more people can join us. Right now, I can see that we are 8 of us that are online. We need more. If one of us, each one brings one, we will be 16 on this call. Now we are 11. The more we share the link, the more people join us. So please take 1 second, take a screenshot of your page, forward it to your status, add the link from this live, and tell people, come and join us for tonight's session. Welcome, Mariam. Thank you so much for being here. When you come, you can feel free to say hello in the comments. If this is your first time joining us for the webinar, let us know in the comments. Is this your first time? Is this your second time? Is this your third time? How many of our webinars have you attended? Please let us know in the comments, and I would love to give you a shout out. Hi, Patience Bulus. Thank you for joining us. Hi, Joyce. Thank you for joining us. We want to get more people to join us on tonight's session. So please take a screenshot of your page, forward the link to your status, and tell people they need to join this webinar. They should not miss this webinar. It is going to be an informative time. Hi, Hafsa. This is your first time here. Let me give you a round of applause. Thank you so much for being here. We are going to be the last time that you are going to be on this webinar. So without further ado, I trust you to share the link. Can I trust you? Because I believe we can invite more people to join us. All right. So without further ado, I will be inviting on stage our facilitator. Hi, Mesu. Thank you so much for always being here. Shout out to you. I'm giving you 2 shout outs. Shout out to you. Fideros, thank you so much for every webinar you've been here. Thank you so much for always being here. All right. So I think it's high time that we bring our facilitator on stage. So I am pleased to be bringing on board our executive director, Dr. Ibrahim Yakub Sime, who is a renowned, very, very important that I mentioned, a renowned gynecologist and fertility specialist. He is the CEO at Well Life Hospital, Abuja, and he has been gracious enough to facilitate almost 80% of our sessions on Well Life Health Talks. He deserves a round of applause. So wherever you are, please let's give him a round of applause. Tonight, he's going to be talking to us on why does IVF fail? The truth many people don't hear. So today we're going to be shaking some tables. You're going to be hearing some things that are going to blow your mind. You're going to relearn, you're going to unlearn, you're going to learn new things. So open up your heart to learn. And remember, share this link. Invite your friends, invite your family to join us. Hi, Fatima Omar. Thank you for joining us. Hi, Bill Kisu. Thank you for joining us. Mujiba, yes, you deserve World Cup. In fact, you've been at all of our webinars, and I appreciate you. All right, ladies and gentlemen, permit me to just bring on stage our facilitator for today. Good evening, sir.
As usual, good evening, Christine, and good evening to everyone that has joined us so far. We're happy to have you here once again. Thank you.
Thank you, sir.
Well,
So I will leave the stage and hand it over to you, and you can share your screen. Thank you, sir.
okay. All right. Just a minute, please. Sorry, just a minute. Okay, that's great. Okay, welcome once again. As Christine said, today we're going to be talking about an important topic related to in vitro fertilization failures. Why is it important? This month, the month of June, is designated as Infertility Awareness Month. And we believe that in that spirit, we should talk about things related to infertility and to create awareness amongst people, particularly those who are already saddled with these challenges. So, without wasting most of our time, I'm going to go into our slides. So, as a background, we'll look at uh, what is IVF in the first place. In vitro fertilization, that's the short form, or that's the what IVF means. And so far, it has remained the highest form of fertility assistance to couples who have infertility problems. And it actually started sometime in 1978. And since then, we have over 17 million babies who have been delivered via IVF process. But of course, this is actually a very conservative estimate because considering the fact that there are so many IVF centers whose data is most likely not even available for estimations, for a global estimation. But generally, we know that we feel more than 17 million babies have been delivered via IVF since 1978. What does that tell you? It tells us that yes, indeed, IVF remains one of those uh, assisted reproductive techniques that has helped millions and millions of couples over the years to have babies. Couples who otherwise may have thought their situation is doomed as far as fertility is concerned, they have been helped over the years. And in these years, there's actually been a lot of improvements in the science of infertility management. So much has been done. So much is still ongoing in terms of research to improve the capacity of mankind to help this group of people who have infertility issues. But then there's still a lot of challenges in spite of this scientific and technological advancement. So we see that in spite of the advancements in technology and science in IVF procedures, there's still a lot, to the extent that overall, the success rate of IVF treatment cycles remains frustratingly very low across the world. And I want to emphasize that it is very low across the world, helplessly, as we could put it as well. The success rate per IVF cycle now remains between, on the average, between 20 to 40%. Now, we need to look at this. This applies to all age groups seeking IVF treatment, and this the average range, or is the average range that uh, is considered a success rate all over the world, irrespective of which center you are in. So this means, therefore, in other words, the failure rate is between 60 to 80%. Please let this sink in for a minute. 60 to 80% is the average failure rate for IVF cycles all over the world. And this is a huge issue, actually. And that is why I said in the beginning that the success rate is still frustratingly very low, in spite of all the technology and the sciences that is applicable in this area of human medicine. Now, for a couple seeking IVF treatment, of course, most of the time, the couple that will seek IVF have probably tried every other thing to have a baby, but they have not succeeded. And so, almost always, IVF is the last resort thing they want to seek. And one of the very common questions they will ask you is, what is your success rate? So now this supposes therefore that, it creates an impression that as far as the couple is concerned, their success or failure for their IVF treatment is entirely the facility or the doctor's issue. And so, but unknown to them, and usually contrary to what many people think, up to 70% of the reasons for IVF failure is actually accountable to the couple. That is, IVF fails most of the time not because of clinical factors, but because the patient or the couple factors are the reason for IVF failure. So the clinics or IVF centers anywhere in the world account for just about 30% of the reasons for IVF failure. So this, I know, it's contrary to what people expect and what people think, and this is one of the reasons we need to sensitize people, because as we go along, we will see that factors that we overlook in ourselves are more important, okay, for success or failure of IVF cycles than which clinic you attend. So let's look at the determinants of IVF outcome. Now, when we say IVF success or failure, we're not talking about just doing an IVF cycle or IVF treatment and having a positive pregnancy test. No, or a negative pregnancy test. When we say IVF succeeds, what we mean is that you have done an IVF cycle, you have a positive pregnancy test, and ultimately have delivered a live baby at the end of the pregnancy. That is what we mean by IVF success. Anything contrary to this, whether you have a positive pregnancy test, if you have a positive pregnancy test following an IVF treatment, and you have an early miscarriage as a result of one thing or the other, then we say that IVF has failed. So the factors we're going to look at, this determinants or these factors are the ones that will determine whether or not at the end of your IVF treatment you have a live baby. Now, We'll look at them one after the other. Semen quality is very important, of course, though a lot of times we seem to overlook this. So such that if, for instance, you go to an IVF center and they do your husband's or spouse's semen analysis, and the semen quality for one reason or the other there's a problem, that in itself is the beginning of potential failure for the IVF cycle, as compared to someone whose husband's sperm quality is optimal. That same goes for the egg quality, of course. This is the woman's egg, and its quality, of course, is one of the very, very important reasons why IVF may fail or succeed. Embryo quality. Embryo is the result of fertilization of the egg by the sperm, and the quality of the embryo ultimately will determine whether your IVF will succeed or not. Then conditions of the womb in the woman, because at the end of the day, it's the woman's womb that the baby will grow in. So its condition is as important as the baby itself. So at the end of the day, you can see that we have sperm, egg quality, embryo quality, the conditions of the womb. These are entirely not dependent on the clinic. The clinic is just one of the last places that will determine whether or not your IVF will succeed. So we're going to be looking at the real causes of IVF failure in the next few slides. So let's look at the male factors. In this case, of course, when we say male factors, it's the sperm in particular that we're talking about. Now, as I said earlier, one of the reasons we do sperm quality test, or what we call seminal fluid analysis, is to know from the very beginning of the IVF cycle what to expect as far as what is our potential for success or failure. Okay, considering the fact that we know sperm quality determines to a very large extent whether it will be able to fertilize the egg or not. So that once we start, these are the issues we're looking at in the sperm, right? First is the sperm motility, or what we call activity of the sperm cells. This, to a very large extent, determines whether or not the sperm is even able to fertilize the egg, irrespective of the quality of the egg. Now, where the sperm motility is less than 30% at the time of your IVF cycle, this in itself is a challenge that may contribute to failure of the IVF. So yes, we do know that in today's times, scientific advancements has allowed us to assist such sperm cells to fertilize, but that process itself sometimes may lead to poorer embryo quality as compared to where the sperm is allowed to fertilize the eggs on its own, what we call conventional IVF. So where sperm motility is low in itself, it's a risk factor for IVF failure from the very beginning. Abnormal morphology is where the sperm appears abnormal under the microscope, and there's a minimum number of abnormal cells, or rather, a maximum number of abnormal cells that will portend failure or success of your IVF cycle. If we have normal sperm cells less than 4% of the total sperm count in the spouses or husband's semen, that is a risk factor for an IVF failure. Then low sperm count, of course. Generally, we look at sperm count as normal, where the total sperm count is above 15 million. Where it is less than that, from the very beginning during the IVF treatment cycle, it's actually a risk factor for IVF failure. Now, sometimes we do sperm analysis and we see that as far as the naked eye examination of the sperm is concerned, what we call gross features and the things that we look out for to determine whether sperm is normal or abnormal, We may adjudge a particular sperm as very good, meaning, okay, the count is good, the motility appears normal, the morphology looks all normal, and we say that yes, indeed, based on that, those parameters we use, the sperm is good. However, sometimes there's a salient sperm characteristics that can determine whether your IVF succeeds or fails, and that is usually not visible to the naked eye because it has to do with the DNA quality of the sperm cells themselves. And so there's a parameter called DNA fragmentation, or there's a scientific a name for that. We call it DNA fragmentation index. What this means is that how fragile is the sperm DNA. As I said, this is not seen or cannot be seen on the microscope, but yet it's one of the most important parameters or factors that will determine whether your IVF succeeds or not. So if your DNA, if your spouse's DNA fragmentation of the sperm cells is greater than 15%, that in itself is a risk factor for IVF failure. Of course, this is something that is not usually visible under the microscope, but then sometimes we only do this test where we have recurrent IVF failures that we do not or we cannot explain. So all of the above factors, meaning the male factors, contribute to poor fertilization and poor embryo quality development. Now let's look at the female factors. Now, as we can see, there's a lot more to talk about in the female than the males for obvious reasons. First, the fact that the woman's contributes to the egg that is to be fertilized. Secondly, the woman is also the receptacle for the baby. Okay, so for the woman, we have quite a number of factors that we have to that may contribute to IVF failure. Now, the very most important really is the egg of the woman, or what we call the poor egg quality or good egg quality, as it were, for successful IVF. Now, poor egg quality is one of the most important contributors to IVF failure. Now, there are factors that can actually contribute to poor egg quality in the woman, and the most important factor is the woman's age. We usually tell women, contrary to what people think, a woman does not produce new eggs in her lifetime. I keep telling my patients, and sometimes people get surprised. People will believe that every ovulation a woman produces a new egg. No. In every ovulation, you just go to your storehouse of eggs, which is your ovaries, and from there, what you were born with, amongst the eggs you were born with, one or two will be released per month, and others are wasted. That is what happens. So, to the extent that after the age of 35, usually there's a an age-associated decline in egg quality. This is a biological process that nobody can change. All right. Now look at these features here. For a woman above the age of 40, for instance, who chooses to use her eggs for IVF treatment, her failure rate is as high, could be as high as 85%. That is because at the age of 40, most of her eggs have actually gone bad because of issues related to degenerative changes, including DNA problems that we mentioned in the sperm. So if, however, this woman, this same 40-year-old woman, chooses or accepts to use eggs from a younger donor below the age of 35, for instance, her failure rate will decrease to less than 30%. Okay, and this is very, very significant, and we need to think about it, especially for some of us who have tried IVF with our own eggs above the age of 40 and we keep failing. We may want to consider the use of donor eggs to improve our chances or to reduce the risk of IVF failure. Now, what are the other things that can affect the woman's egg quality? A lifestyle, of course. Generally, women who smoke smoking tends to destroy human gamete, that is sperm and eggs. So if you smoke and you go for an IVF cycle, especially if you smoke significantly, there's a possibility that your air quality may be compromised, and that may be a reason for your IVF failure if you try your eggs, irrespective this time irrespective of your age. I mean, all right. Now, if you smoke and you are advanced in age, of course, that may be double tragedy for your eggs. Alcohol also is a toxin that can affect air quality. And of course, if you take alcohol and go for IVF, it will be advised to perhaps stop, of course. But they see we need to remember that stopping smoking or alcohol intake at the time of IVF cycle may not help you much. So if you're planning an IVF cycle in few months, it will be wise for you to quit smoking for some months, to quit alcohol intake for some months, so that at least your egg quality will improve before you attempt your IVF cycle. Now, some other things that could affect the woman's egg quality is a personal care product. In recent times, we're seeing quite a number of people who are using all kinds of things, especially, I mean, women want to look beautiful and all of that. But unfortunately, some of these beauty products, some of the things we use for personal care, including our perfumes, our roll-ons, our the hair shampoos, some of them contain substances that can interfere over time with your egg quality and perhaps may lead to your IVF failure. So these are very important things we need to think about, so that we know that if you're going for an IVF, you need to prepare yourself for it, to make sure that you have optimized your egg quality before you start your IVF cycle. Otherwise, at the time of the IVF cycle, once the egg is poor in quality, there's nothing your doctor can do about it to improve your chances of success. Then we have another helpless situation: environmental exposure to environmental toxins. Now, this has to do with what is in our environment that we unavoidably get exposed that may affect our IVF success. And there's a lot of substances in our environment today, from what we eat to what we drink to what we inhale, and all of those things that can affect air quality, that may compromise our chances at IVF. Now, besides the womb, the other factor is the womb itself, that is the uterus. Of course, we do know that in an IVF or in pregnancy, usually sperm and egg will meet somewhere, a baby is formed, and then the baby eventually goes into the womb to settle. So if the womb is not optimized, if the conditions in the womb of the mother, of the woman, is not optimal, of course it will lead to IVF failure. And the very specific things we will look at in the womb that may contribute to IVF failures will be: first, the lining of the womb. The lining of the womb is a material called endometrium. That's the inner lining of the womb. That we will akin to maybe the topsoil in the garden. If you're a gardener and you want to plant crops, of course, usually you have to till the land, you prepare the topsoil, you add manure, you irrigate it, and all of those things. So that inner lining of the womb is similar to the topsoil of a garden where you want to plant your seed. So if the topsoil is not optimal and you want to plant seed, in this case, the seed is the embryo that is going to implant in the womb. If it is not optimized, of course, the IVF may fail. And there are a few characteristics about that inner lining that's important. So the thickness of the endometrium, that is how thin or thick it is, determines whether or not your IVF will succeed. If the endometrium is less than 7 millimeter thick, in most cases, implantation may not take place. If it is also thicker than 14 millimeters, sometimes it is similar to when you have your topsoil in the garden that is waterlogged, so to say. So it is not all crops that can grow in that situation, except certain specific crops that would not mind waterlogged environment. So the thickness of the endometrium or lining of the womb is very critical to whether or not your IVF will succeed, because it will determine whether or not implantation will take place. That is the embryo implanting in the womb. Now, the other factor in the womb related to the lining of the womb is what we call receptivity. Receptivity of the endometrium is how ready the lining of the womb is for or to accept the baby that we want to put in there. Now, this receptivity is not available throughout your menstrual cycle, because research has shown that there's what we call implantation window, or a maximum receptive period of the lining of the womb during a woman's menstrual cycle. Of course, man has not been able to precisely determine the date when the endometrium is in its best receptive state, but generally we say it ranges between day 17 to around day 24 of your menstrual cycle as a woman. So doing embryo transfer outside of this receptive window may actually lead to what we call failure of your IVF cycle. So it's important we remember this as well. Now, other abnormalities in the womb that can cause IVF failures will include certain things called polyps. Polyps are small finger-like projections or growth of this same endometrium, more or less like some bubbles or little rocks in the garden that would prevent implantation of the baby. The same thing goes with fibroids. Now, fibroids, I have to emphasize here, a lot of times how fibroids or how they lead to IVF failure is related directly to their position. When fibroids are situated inside the womb to the extent that they interfere with the shape or nature or blood flow to the endometrium, that is when they can cause IVF failure. Otherwise, fibroids that are outside of the uterus, in the uterine cavity, may not interfere with your IVF failure, except if they are too large that they tend to also interfere with the blood flow to the womb itself. Then scar tissues within the cavity of the womb, or what we also call adhesions within the cavity of the womb, can cause your IVF to fail. Then chronic endometritis. Chronic endometritis is a condition where there is an infection that specifically affects the lining of the womb, but sadly, in most cases, it does not have any symptoms. In other words, most women who have chronic endometritis are not aware they have chronic endometritis. Unfortunately, the normal routine tests that we do in hospitals do not generally detect this chronic endometritis. Like if you do a scan does not see chronic endometritis. If you do a swab does not see chronic endometritis. So it's been documented that up to 40% of women, especially those who have recurrent IVF failures, if every other thing has been adjusted fine, may be attributable to chronic endometritis, which was not identified at the time of their IVF cycles. So these are women factors that can affect your chances of success or contribute to failure of your IVF. Now we still have the woman's general health as a factor in contributing to failures. Now, if a woman generally has nutrition deficiency, certain nutrients are necessary for the woman to be able to, in the first place, get pregnant and then to carry the pregnancy through. This is the reason you see people recommending supplements for women to take, particularly women who are battling with infertility. This is the role of supplements in IVF or infertility treatment, is just to optimize the woman's general health so that she can be receptive to the baby and she'll be able to carry the pregnancy to term ultimately when the baby implants. So general health, one of the very common things we're seeing these days is vitamin D deficiency, and we've seen some women who have vitamin D deficiency having IVF failure, recurrent IVF failures, until the vitamin D is corrected, and so many other nutrient deficiency that also have been shown to contribute to IVF failure. So at the end of the day, you need to optimize your nutrition, all right, to be able to get pregnant or for your IVF to succeed. Stress is one helpless situation that most women who or couples who are going through infertility usually, I mean, it's one of the problems they face, and it's difficult not to be stressed when you're helpless, looking for something for years and you're unable to get, and particularly with all the stigma associated with IVF failures or infertility. So stress is almost always inevitable, but then if you're wise to manage stress, okay, you may be able to help yourself. Otherwise, stress leads to release of what we call stress hormones, particularly cortisol, adrenaline. These are hormones that the body releases for fight or flight. Now, what that means is that the body releases these hormones when it perceives that for some reason you are in danger or survival mode. It needs to put you in the survival mode. And once you enter survival mode, as a result of this, the body considers that every other thing you need to do, I mean, pregnancy will be an additional burden. So therefore, these things will work against you getting pregnant. And so stress is one very important factor that can lead to IVF failure. Then other organ diseases like thyroid diseases, okay, in here there's a small organ somewhere situated around just below the Adam's apple. We call it thyroid gland, and its activity is responsible for optimal biological functions of most body tissues, including your reproductive function. So if the hormone it produces is too little or too high, it could lead to your IVF failure. That is why in most centers, at the beginning of your IVF cycle or treatment cycle, they will also test for these hormones. But these things sometimes are ignored, and that could be the reason for failure. Autoimmune conditions, this is where your immune system is overactive and it is undergoing some kind of or undertaking some kind of self-destructive processes. There are so many of them, okay, but the one that is specific for and specifically associated with pregnancy failures and IVF failure is called antiphospholipid syndrome, APS for short. This, in our own personal practice, we've seen women who have had antiphospholipid syndrome that was not detected and they have gone IVF, they've done IVF several times, it has failed. And once this is corrected, they tend to have successful IVF outcome. So some other infections, Touches syndrome, this is a group of infections that can actually also lead to IVF failure and all of that. Diabetes is another condition that can actually lead to IVF failure, especially where the sugar is poorly controlled over time. In fact, we advise any woman who is diabetic or who has a strong family history of diabetes to make sure that she checks herself and optimize her sugar level before she starts an IVF cycle. Otherwise, that can lead to IVF failure. There's a test that we can do sometimes. If the HbA1c is greater than 9%, in most cases, the IVF will fail. So let's go to the embryo factors. Of course, embryo is similar to a seed that you want to plant in a garden. Of course, the quality of this seed in this case depends on what makes up the seed, the sperm and then the eggs. But apart from sperm and egg quality that may eventually determine embryo quality, that sometimes we have a good embryo that in the process of its own growth or development may suffer some abnormalities which are related, which we call chromosomal problems. That is, the DNA carrying substance, which we call chromosomes in the cells, are deranged in the process of development of the baby. such that sometimes the baby has conditions we call monosomy, trisomy, and the rest of them, and eventually may make the embryo not to be able to implant. However, this embryo may still physically appear very good when we grade it the way we grade it, grade 1, grade 2, grade A, grade B, as it were, may look normal physically to the in the as far as the naked eye examination is concerned, but yet this embryo may have chromosomal breakages that may not allow you to implant, and that is one of the reasons for IVF failure. But this is one of the reasons sometimes we do a test called pre-implantation genetic testing to identify embryos that may have these chromosomal abnormalities, especially where we have women having recurrent IVF failures. Then embryo may get damaged during handling. This is where the facility factor comes in, and we're going to get to that soon. And then exposure of the embryo to volatile organic compounds or dust particles in the lab. This is where, of course, we're going to get into next. That is the clinic factor. Now, how does the IVF center or the hospital or clinic contribute to your IVF failure? Now, again, I want to emphasize the fact that from all that we have seen so far, we realize that the clinic is only responsible for 30% of the reasons your IVF may fail, looking at all the things we have seen throughout before now. So now this is where the clinic contributes to your IVF success or failure. The lack of properly trained personnel. If the IVF specialist is inadequate, does not have adequate knowledge or skills or experience to treat you as a patient, IVF couple, then of course your IVF may have failed before you even start. So here, the role of the specialist, the IVF doctor, is very critical because he or she is responsible for identifying or evaluating you appropriately, not only to know whether or not you will give eggs, to identify factors within you as a couple, the husband or the wife, that may mitigate your situation, I mean, your process, so that once these things are identified, he or she in the beginning will advise you on when is the appropriate time to do your IVF cycle, having identified those things that he or she may need to correct. So this is where the IVF specialist role is. Embryologist is the person trained to handle the sperm, the eggs, as well as the embryos. Okay, and they do that in a special lab called the embryology lab. Now, this person's knowledge and skills also determine how well, okay, your embryos will do at the end of the day. Okay, so this is what and how poor training or skills on the part of the embryologist may lead to your IVF failure. Now, lack of appropriate equipment in the center. Okay, for instance, you walk up, if the center does not have appropriate facilities to even carry out initial evaluation of the patient or the couple. For instance, sperm analysis, the initial ovulation, initial hormonal assays and the rest of them, and then even the scanning, as well as advanced equipment like hysteroscopic equipment or laparoscopic equipment that will enable them to identify factors in the couple that may hinder their success. Then, of course, the facility may contribute where they have such poor equipment may contribute to their IVF failure even before you start, because it means that they may not be able to identify things in you that may contribute to your failure. Then, of course, if the facility has a substandard embryology lab or poor quality control of the embryology lab, that is where your eggs, the sperm, and the embryos are handled. There is usually a very specialized lab that has very stringent control systems to ensure that your the sperm or the eggs or the embryos at the end of the day are not exposed to anything that may damage them. So lack of this facility or standard lab may also contribute to your IVF failure. And of course, how the facility handles the IVF medications and other IVF consumables, the media, the drugs, particularly the IVF medication. Most of the IVF medications or consumables require certain preserving conditions or preservation conditions. One of them is temperature control, particularly some of the drugs used for ovarian stimulation in the first cycle treatment process for IVF require certain temperature. We call it cold chains. So if the facility or the clinic or the hospital does not have a 24-hour power supply, to the extent that they do not have refrigerators that will make sure that everything that is necessary to be used on you are kept under appropriate temperature controls, then of course the facility may contribute in that sense to your IVF failure. So at the end of the day, of course, we know that, as I said earlier, IVF is considered a last resort assisted reproductive technique. And IVF, for those who have embarked upon it, is mentally, financially, emotionally, and physically draining. So its failure, therefore, is associated with a deep sense of hopelessness and psychological meltdown. So for anyone who therefore wants to embark on the IVF, on your IVF journey, it is important that you know the real causes of IVF failure and then address them appropriately before you get to the hospital or clinic so that your chances of success will be optimized. Do not think that the hospital would correct or would be responsible, okay, to correct whatever it is that you have that will mitigate your process. If you do not, for instance, live well, good quality life, you don't have good nutrition and all of that, well, the clinic can do it best. Where your sperm quality is bad, your egg quality is bad, the clinic may not be able to do much, as it were, except that they may identify this in the beginning and advise you not to go for the cycle. Sadly, some of these things are not corrected overnight. So for those of us who are planning to do IVF or have had IVF failures, please do well to get to a center that has facilities to properly evaluate you and perhaps identify those factors in you that have led to the failure much more than the facility, and therefore your IVF may succeed. Thank you very much. I will leave the floor for questions and answers. I hope that we have clarified this situation. Christine, if you're there, perhaps you will take over from here. Thank you very much.
All right. Thank you very much, sir. Thank you so much for always giving us value. Please, can we say thank you to Dr. Yakub in the comments? I can already see Joy Ayuba. Nice to see you. She's already saying thank you, and many others are saying thank you. Thank you so much, sir. So we have a couple of questions. And I will be reading out the questions, and then Dr. Yakub will be answering the questions for us. All right, so I will go back to the very first question that was dropped. Please let us know if tonight's session has been valuable, okay? Let us know if today's session has been valuable. Please, we want to hear from you. All right, our first question says, what can be done to correct or improve the lining of the womb? So that's the first question. So I think you'll take it question by question because there are quite a number of questions. So over to you, sir. I think you're muted. So you're muted.
Okay, thank you, sir. Sorry about that. Okay, can you hear me now?
Yes, very well.
Okay. Generally, there are things that can lead to abnormal lining of the womb. In particular, the commonest we see is where the lining of the womb is thin. One of the very common causes of thin lining is where you have scars, okay, or adhesions in the cavity of the womb. And what we need to do for that specifically is to actually going into the womb cavity to break up those adhesions or scars, and then give the woman some medication to attempt to build it over time. But sincerely, this has to be done in a facility or in a clinic that has equipment to even identify the reason for the low lining. Now, in addition to procedures like what I mentioned, hysteroscopy or the rest of them, sometimes we also give certain medications, specifically estrogen medications that we know that can build the endometrium. Now, in addition to estrogen, sometimes we also give certain supplements that can improve blood flow to the lining of the womb. And in most cases, when you do all of this, the lining of the womb gets optimized and it can be corrected. Thank you.
All right. Thank you very much, sir. So our next question is, please can we get clarity on spraying perfume on the neck and thyroid disorders?
Okay, yes, today's topic is not about thyroid disorders, but I will just explain this how this
Yeah.
has been linked to thyroid disorders. Well, perfumes belongs to substances perfumes are fragrances that contain a substance we call phthalates. Phthalates are hormone disruption chemicals. Well, by the way, the thyroid gland, I said, is situated somewhere around here, just under the Adam's apple. And it is believed that whatever you spray on your neck, especially once this spray comes in contact with your skin, some of the substances in the spray eventually get absorbed. And once they get absorbed, one of the organs around there immediately to come in contact with it is the thyroid gland. So if your perfumes contain substances that may interfere with the hormonal profile, the hormone condition of the thyroid gland, some may stimulate the thyroid gland, some may suppress it, and all of that. So now, of course, research is now coming out to show that yes, indeed, exposure of organs to some of these substances may lead to the disease of the organ. So that is simply how it happens because the thyroid gland is close to the neck or is around the neck. So it's believed that spraying perfumes which contain endocrine disruptors may contribute to thyroid disease. That's how it comes. Thank you. I hope that answers the question.
Thank you, Mujiba. I hope you got answers to your question. I hope that Joyce Alexander also got an answer to her question. All right, the next question says, can any of the female factors mentioned, I believe from your webinar, sir, still cause a stillbirth after a successful IVF? Can any of the female factors mentioned still cause a stillbirth after a successful IVF? That is the question.
Yes, of course, indeed. As I said, that's why I try to clarify that when we say a successful IVF, we mean that pregnancy test is positive and the woman eventually delivered a live baby. Anything short of that is considered a failed IVF. And when we say IVF failures, this is actually what we mean. So whether your IVF led to negative pregnancy test or an early miscarriage or eventually a stillbirth, we consider that IVF a failed IVF cycle. And of course, some of those things we mentioned can actually lead to that. For instance, I mentioned diabetes towards the end, considering the general health of the woman. Yes, if a woman is diabetic and the sugar is not well controlled, whether she has a positive pregnancy test at the end of her IVF cycle or not, sometimes the diabetes can eventually kill the baby at some stage during the course of pregnancy. Yes, indeed, it's true. And other things that can also cause death of the baby will be those things we mentioned in the female factors when we talk about infections. Okay, there are certain group of infections that can get to the baby eventually and may cause what we call IUFD, that is stillbirth, okay, in the baby. Yes, it does. Okay, and there are factors that can do that as well. Thank you.
Thank you, sir. So, Hakima, I hope you got clarity, concerning your question. All right. The next question says, if the embryo is poor or DNA, can this cause Down syndrome or autism if it eventually gets planted? That is the question.
Oh, yes, yes. One of of course, I mentioned that DNA abnormalities in the embryo are responsible for failure of IVF. However, it's not all the DNA abnormalities that are not compatible with life. There are some of them that will be compatible with life, like Down syndrome, right? So a baby who has Down syndrome, yes, has DNA abnormality, but the pregnancy will go through. Okay, so it's possible that the IVF goes through in terms of, yes, whether or not the baby has DNA, in this case, Down syndrome, and then the baby will be born with Down syndrome. It's just that some of the DNA abnormalities may not be compatible with life, so the embryo will not implant in the first place. Now, as far as autism is concerned, autism is not, so far from what we know about autism, it has nothing to do with DNA. There's no specific organic disease condition that is attributed to cause autism. All right. So far, we don't know what directly causes autism, and it has absolutely has nothing to do with IVF or abnormalities in the baby as far as autism is concerned. And so we see babies born normally, whose pregnancies were conceived normally, ending up with autism. Of course, we've also seen babies who were conceived via IVF, ending up with autism. But autism, per se, has nothing to do with whether or not the baby was conceived via IVF. Okay, so I hope that explains or answers the question.
Thank you, sir. So, hectare by hectare, I hope that you got clarity concerning your question. All right. The next question says, can absence of sex on the part of the woman be a likely cause for IVF failure? I mean, could such render the womb inactive, thereby not being receptive to nurturing the embryo?
Well, that's interesting, but from what as far as science is concerned, sex or the frequency of sexual intercourse does not directly contribute to a woman's potential to get pregnant per se, as in especially IVF. Okay, where sex is important is where a woman is actually trying to get pregnant naturally. Okay, so the frequency of times the egg and or the sperm available and egg is available is what determines pregnancy. However, sexual intercourse or absence of it does not in any way affect whether or not the woman's endometrium, that is the lining, is receptive or not. The only link, maybe a distant link, one would say, between sexual intercourse is maybe contracting or contracting STIs, for instance, during sexual intercourse. That is, if for any reason a woman contracts STIs, that's sexually transmitted infections, and that may affect the lining of the womb, and so may affect the receptivity. Otherwise, sex has no direct role in determining what the IVF outcome will be. Thank you.
Thank you, sir. So, Joyce Alexander, I hope that this answers your question. Our next question, I'm loving the interactions tonight. So, sir, the question says, please, what's your view on ovarian rejuvenation with PRP?
Well, yeah, this is a recent thing that is now becoming popular. That is, ovarian rejuvenation means that, okay, there's an attempt by a man to try to wake up the ovaries. Okay, where I mentioned that the ovaries are the storehouse of your eggs as a woman, and at some point in life, those eggs seem to either degenerate in quality or in numbers. That's a biological process. And so man is trying to now ask this question: is it possible that we can wake up the ovaries when they are dead, or when they have stopped working, or even when the egg qualities are bad? Now, so far, there are scanty researches here and there that have shown that women have gone through this process of ovarian rejuvenation and it worked for them. But for now, as far as evidence-based medical practice is concerned, it has not been shown that every woman whose ovaries have packed up will benefit from any form of uh, ovarian rejuvenation. I have personally seen patients who were not even who have been adjudged whose ovarian reserve is poor, their egg quality is bad, and they were treated with PRP In this case, what is done is that the patient's blood is taken and then centrifuge and then injected into the ovaries so that they wake up with the hope that perhaps there are what we call pluripotential cells or germ cells within the ovaries that can wake up. But I have seen patients who have done these procedures and in fact they went from bad to worse. So I cannot say that across board it may work or it works for every woman. But any woman who has a challenge of ovarian failure, either as a result of menopause or as a result of what we call premature or premature ovarian insufficiency or failure, may just try it to see what happens. After all, by the time you're told that your ovaries have packed, you don't have a choice but perhaps to go for donor eggs. In that case, if you want to try it and see whether in your case it will work, you can try it. But generally speaking, it does not work across board for every woman. Thank you.
Thank you, sir. All right. The next question says, in a situation where the AMH is low and the egg quality is low, can lifestyle and vitamins help to improve it?
Yes, of course. Yes. We have seen, as I said, because there are certain things that people do that tend to affect the body generally, okay, and particularly your eggs as a woman. Now, imagine a woman who grows up in a poor society or poor environment where her nutrition is poor. Okay. Of course, her physical appearance, if a woman is malnourished, let me put it that way, her physical appearance will tell you that yes, this woman is malnourished, isn't it? Now, if the woman, however, gets the benefit of getting better nutrition, eventually you see that her features will change, the skin will glow, and everything else will change. So that is the same way when, as a result of lifestyle problems, your ovaries are damaged or your AMH is low and all of that. If you get better nutrition, especially if your situation is as a result of certain nutrient deficiencies, once you take those nutrients over a period of time, of course, your egg quality will improve. And in our practice, we've actually seen women who have had low AMH. AMH is a hormone we call anti-Mullerian hormone, which gives us an idea of how many eggs or the egg pool of the woman. And of course, when we give them certain supplements over a period of time, usually 3 to 6 months, you see that these things improve. That is because their general nutrition has improved in the same way one who was malnourished has eaten better or is now well nourished and appears better. So that's the same way. So yes, indeed, vitamins and certain lifestyle changes can improve your AMH and air quality eventually. Yes. Thank you.
Thank you, sir. Next question. Is there a situation where the egg stimulation injections may affect egg quality?
Yes, of course, indeed. This is why I mentioned that this is where your facility or your hospital or center comes in. Choosing the best and appropriate drugs for your own egg stimulation and choosing the appropriate protocol, okay, to bring out your eggs matters a lot, okay. And so, yes, indeed, the process of egg stimulation is very sensitive, and not getting the right combination of eggs, or rather drugs, can actually affect egg quality, okay, at the end of the day. So, in addition to whatever it is that you have, choosing the right drugs actually can affect air quality. So this is where your IVF doctors or physicians' role in contributing to success or failure of your IVF comes in, really. So choosing the drug, for instance, if in a center they have poor drug maintenance culture and they're not able to maintain the drugs at the appropriate temperatures that they are, of course, it will affect your egg growth and quality at the end of the day. So that is very true that egg stimulation injections can affect quality of the eggs. True.
Thank you, sir. Next question says, please, what causes a woman's menstruation to cease after myomectomy? Can such a person undergo IVF?
Okay, well, yes, myomectomy is the surgery we do for removal of fibroids, right? Now, sometimes fibroids, when they are being removed, some of them are situated right inside the cavity of the womb. so that when the doctor goes in there, okay, to remove those fibroids, the doctor unavoidably breaches or enters that endometrium that we're talking about, the topsoil we talked about before. And when he comes out, the process of healing creates a scar in that topsoil, so to say, in the endometrium. That will effectively can reduce the number of days the woman will flow during her menstrual period, or sometimes when the scar is extensive or the adhesions are extensive, the flow will stop altogether. The other condition that may cause a woman's period to cease following myectomy is the fact that perhaps the woman was already premenopausal. If a woman in her 40s, for instance, does a uterine fibroid removal, and then she's already premenopausal before she did her surgery. Of course, it's not in this case the surgery that caused her menses to cease, is because she has already transited into menopause. But more importantly, if a woman is young and has done fibroid surgery and her menses cease thereafter, most likely there's a significant scarring of the interior of the womb, and so the period or the menses can cease thereafter. I hope that has answered
Thank
the question. Okay.
thank you, sir. All right, the next question says, what is the biggest misconception people have about IVF success and failure? The biggest misconception.
Well, it's again I think the reason in the first place that we decided to address this is because for me, in my own practice, I think the biggest misconception here is that it's the facility that determines whether your IVF fails or not. And that is why you see that a woman who is not aware of some of these factors in her or her couple may move from one center to the other, and yet the IVF treatment cycle keep failing because they do not realize that the reasons for the failure is not the facility per se, is actually it's in them. And until and unless these things are addressed, there is no way, there's nothing the facility can do about it. Now, very closely attached to that is the belief that science and medical science can override human biology. It's not true. So people believe that, okay, no matter how bad my eggs are, or no matter how bad the sperm may be, or whatever the situation in my womb is, the doctors can correct it and therefore can make my IVF succeed. It is not true. It's a general misconception. So I tell people that for your IVF to succeed, it is it's a synergy between biology and science. And once the biology is wrong, science cannot help you. Once the science is wrong, the biology will fail. Things like that. So, but the most important thing is to realize that the human biology, that is the woman's life and everything else, as well as is the most important factor that will determine whether or not your IVF will fail. So please let's remember that anytime we think of IVF.
Thank you, sir.
Yeah.
All right, next question. For a woman who is 38 years old, every test came out good aside that she's having low AMH. What can be done to improve the egg quality and the AMH level?
Okay, I think there was a question related to AMH in this before, and we mentioned that yes, at 38, yes, of course, because of age. I mentioned in the presentation that after 35, generally speaking, most women's egg quality will decline. That is biology. So at that point, once you do, and now in this case, we're talking about quantity as well. But I want to mention that for IVF, we prefer quality to quantity. So if the AMH is low, that suggests that you have a low egg pool. If the quality of the eggs are okay, however, of course, even with a low egg pool, with a low AMH, you can still have a successful IVF outcome. However, you can improve upon the quality or the quantity. In other words, your AMH can improve, okay, depending on what in the first place is responsible for your low AMH. If it is a lifestyle related thing, If it is nutrition related thing, of course, these are easy things. You can take supplements, and over time, your AMH will improve. But if it is not, if your DNA, X DNA is damaged for whatever reasons by things that you've done in the past, there's nothing so your supplement may do at that point, And that is why we also mentioned that women, of course, who go around taking all sort of supplements in the hope that this will correct certain things that they probably do not want to address, it is not all the time that supplements may help you. Now, whether or not supplements will help you in your IVF procedures, it depending on whether or not you have deficiencies of those supplements you're taking in the first place. And if it is that deficiency that's responsible for your inability to conceive. So let's be aware of this as well. There are so many other things besides supplements that can affect you. Okay. I hope I've answered
All
that
right,
question.
so I'm going to be tying up the questions. I can see some questions that are looking more like consultation questions, and maybe we will make room for some consultation after here. So I will just pick two more questions and then we can call it a night, because I'm seeing a whole lot of a woman at this age, a woman at this age, and it's almost as if it's going to turn into a consultation session. All right. So the next question says, what is the best advice to those who have several failed IVF cycles?
All right, the best advice I will give is for them to get to a facility. First, is for them not to give up, okay? Because there's always a way around this thing somehow, right? Secondly, it will be good for them to go to a facility, a hospital, or a center that has their time, really, because sometimes it takes a patient IVF doctor to listen to your story, and in your story, perhaps identify what in your own peculiar situation is responsible for the failures. Then, secondly, the facility must also have equipment to thoroughly investigate you. It is not advisable that because you have had several failed IVF cycles and you're getting desperate, you jump from one facility to the other and request that, oh, I heard that someone did IVF here, it succeeded, and I'm coming here for my IVF without going through thorough evaluation to identify why in the first place your IVF has failed severally. So please, you need to be patient. You need to select a facility. You need to get to a doctor who will sit with you and evaluate you properly, and then has the facility to probably also thoroughly investigate you in an effort to identify what in your own peculiar case is responsible for your failures. Almost always, at the end of the day, with patience and tenacity, you will be able to identify something, and that may correct the failures, and you may conceive eventually. So that is the thing. Get to a center that will listen to you and then has the facility to properly evaluate you and identify the possible factors for your failures.
So at this juncture, I'd like to say that um, in collaboration with Well Life Hospital, since this month is June, this month of June is Infertility Awareness Month. There is Well Life Hospital is holding a series of free consultations that you can take advantage of. So feel free to reach out to Well Life Hospital. I do not know if the direct number could be dropped. I don't know, Mujiba, could you help us drop the direct line to the hospital here so that people can take advantage of that? If you also would like to do your IVF process at World Life Hospital, I can assure you that Dr. Yakub is patient enough to listen to your story, so you could take advantage of that. All right, so let's look at the next question that says, when a cycle fails, how do we figure it out? If the issue was with the embryo itself, or if it was an issue with the womb lining not accepting it.
Well, of course, thank you for the question. This is another brilliant one. Usually, when an IVF cycle fails, of course, the couple always will ask the doctor what happened or what went wrong. More often than not, the doctors have no answers, all right, to the question, because, of course, in the mind of the doctor, he or she was wondering what could have gone wrong, right? So it's usually very difficult at the time of an IVF failure to determine, but almost always before your embryo is transferred, okay, into the womb, the doctors will at least make sure that the thickness of the womb is appropriate. That is usually one of the very first things the doctor will ensure he or she does. And that is the line. Now, whether or not the embryo, or rather the lining of the womb is receptive, that unfortunately cannot be determined from a scan or from very simple, straightforward analysis. There are specific tests to be done, okay, to identify whether or not your failure was due to poor receptivity. And that will require that you are subjected to embryo biopsy. Usually, you will be followed up after the IVF cycle, and then the lining of the womb is taken at some point for detailed analysis to determine what we call receptivity test to see whether or not at the time of your embryo transfer your womb was at its best receptivity. So these are very cumbersome tests and expensive, and it's not readily available in all centers. But usually, however, once an IVF cycle fails, what is done is that the doctor is responsible to looking around or for looking around to see what in your case may have led to. A lot of times, we sometimes don't know exactly what happens. That is because at the time it happened, you can't even get the embryo to analyze anymore because the embryo is gone. And sometimes that is the reason. So it's usually very difficult to identify the cause of IVF failure, except if before the cycle there's already something that is glaring. For instance, you have fibroids and the doctor says, please remove this fibroid before we do. And you say, no, 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 I have faith. My faith will carry me through. And then the IVF fails. So of course, the doctor will tell you that it's because of the fibroid, right? So there are some situations where we have clear-cut reasons to suspect that the cause of failure is this, but in most cases, we're usually not aware. We don't know what happens. Thank you.
Thank you, sir. So we have two more questions and then we'll be done for tonight. So the question says, for a woman who is 40 years with a low AMH of 0.45, can she still use her eggs if every other test comes out good?
Yeah, so if you look, as I said, AMH tells us or give us an idea about the quantity now, not quality of the eggs. So, and more often than not, if you get pregnant, you're probably looking at a baby or two or three, as it were. So the only challenge with low AMH at this stage is that there's a possibility that when your ovaries are being stimulated, you may have very poor yield of eggs or nothing at all sometimes. And that's where the challenge is. And once the doctors are not able to get eggs from you, of course, your IVF will be cancelled. And another area where it may affect your chances is the number of eggs that we eventually get out. If you get 2 eggs, 3 eggs from a woman, as compared to getting 10 eggs, of course, you know that the chances that the woman who has 10 eggs will succeed compared to the woman who has 3 eggs. However, I have to mention this, that I mentioned quality is better than quantity. A woman who has 10 poor eggs and you that has 3 good quality eggs, your IVF may succeed. So AMH per se should not be a factor that discourages you from using your eggs, provided, as you said, every other thing looks good.
Thank you, sir. The final
Thank you.
question for tonight. For a 28-year-old with PCOS, now known as PMOS, only AMH level appeared so high, 22 in brackets. Will IVF be successful and pregnancy progress till birth?
Oh, yes. Well, yes, PCOS or PMOS, now we call it, usually is associated with very high anti-Mullerian hormone levels because people who have PCOS or PMOS usually don't ovulate regularly. And so their AMH is high because their eggs are sitting in the ovaries, they're not coming out. So at any point in time, you check them, they have a very large egg pool that is not coming out. That's why their AMH is usually high. Now, yes, they can have a successful IVF cycles provided their physicians, their doctors know how to manage their situation because with PCOS or PMOS, they usually have very peculiar or peculiarities that need to be addressed before they even go on to do IVF. One of them is the level of male hormone at the time they commence your IVF cycle. If it is not addressed, the IVF may fail. So there are certain steps that need to be taken for such a patient at 22 at 28 to have a successful IVF cycle. But it will now be on the onus is on the doctor, the IVF is to specifically study your situation and know how to approach your own IVF cycle for you to succeed. But it is possible. Yes, indeed. Thank you.
All right. Thank you so much, sir. We can see a lot of thank yous in the chat. Please go ahead and say your thanks. So Memuna is saying this session is coming at the perfect time during Fertility Awareness Month, helping to create much needed awareness around fertility. Thank you very much. Thank you to everyone who is telling us thank you. As you can see, sir, we have a number of our viewers saying thank you for the knowledge that you have shared with us today. We are thoroughly grateful. At this juncture, I would like to thank everyone for making time to be here tonight. It's been an insightful time and we are grateful. Thank you so much. All right, so at this point, we will be calling it a night. I don't know. Somebody just dropped a question. So, do you want to answer that before we call it a night?
In the spirit of the month, maybe we can.
All right. So the question says, for someone who has been exposed to alcohol, give or take, how many months should she stay away to increase her egg quality?
Okay, well, generally the journey of an egg, okay, from the time it starts getting chosen to be released for ovulation, it takes about 3 months generally. And in this period, that's when it is actually exposed to everything and anything you are taking. So the advice is this: for you to improve your egg quality, to get a successful IVF outcome, you should abstain from alcohol for at least 3 months. That are coming out that you may eventually use at the time of IVF will be free from alcohol exposure. So 3 months minimum, but of course 3 months and beyond is advisable. That's what you need to know. Thank you.
All right. Thank you so much, sir. Thank you for the time that you spent with us tonight. It's always an incredible time to have you, our executive director, present to teach us and share knowledge. You do your best to break down the medical jargon for us, and that is always such a delight. We're very grateful, sir, and on behalf of every one of us that attended tonight's webinar, I say thank you. All
Thank
right,
you.
everyone. We have these webinars every 2 months. So please stay tuned. We always send emails to let you know when our next webinar is taking place. So please watch out. Our next webinar should be happening at the beginning of the month of August. So look out for our next topic. It's going to be another juicy, interesting topic. In the first quarter of the year, we had a series of free fertility consultations from the foundation, and we're able to consult with over a dozen couples, to help them on their fertility journey. Do look out for more details on the next cycle of our free fertility consultations under Well Life Foundation. Before we go tonight, please do well to connect with us online. On Instagram, we are at welllife_foundation. On Facebook, we are at Well Life Foundation. Do well to follow. Watch out for the things that we are doing. We're doing our best to take away the stigma that surrounds infertility and conversations around fertility, and we need you to lend your voice and lend your support to this good work that we are doing. So Dr. Yakub, could you give us your final words and then we
Okay.
call it a night?
Thank you very much, Christine, for being there as usual. I just want to mention something that you have mentioned in the beginning, that the fact that this particular webinar was also in collaboration with Wildlife Hospital, and the hospital is in the spirit of the month of June, which is the Infertility Awareness Month. The hospital is embarking on things related to infertility that we believe can help them as well. So I think there's also free fertility consultations the hospital is hosting, as well as some discounted things on. I think people can also visit the hospital to find out what they may benefit from such, but that is certainly limited to the month of June. So as it was. So I thank you everyone for coming, and I hope that this effort will help someone somewhere, okay, that is battling with infertility, and particularly those who have had recurrent IVF failures. Perhaps this information will help them to get the fruits of the womb by the grace of God. Thank you very much.
Thank you so much. So, everyone, this brings us to the end of the 6th edition of our Well Life Health Talks. This video is going to be left on our YouTube channel. So, do well. If you missed some part of the webinar, immediately we're done, you can replay it. If there's someone in your circle, your friend, your family, your loved one, your spouse, whoever that needs to hear what has been learned tonight, you can direct them to the page. The video is going to be there, as a replay. Do well to look out for our next webinar. And we are so grateful that you came tonight. Have a wonderful night's rest and see you at the next webinar. Good night.